Good morning, good morning, good morning! What's up, Taskas teammates? Hello, everyone! So we have a very special show prepared for you today. I'm Carol Zuniga from the Cheer Squad, the engagement and experience team from CHR, and I will be your host for today. So we are live now at our Taskas YouTube channel. So check po natin sino-sino ang mga nandito. Meron po bang mga taga-Lighthouse, House Teamwork, Fort Excellence? Nako, 187 people are online to watch us. Fort Excellence, Chateau Ridiculous, Lizzie's Watchtower, Lizard Bear Lair, Lizzie's Nook, Lizzie's Lagoon, and Lizzie's Playground. Hello, guys! Are you there? Ayan na nga, naglalabasan na, nag-hello sila. No? So, hello, medyo tinasan ko yung energy kasi, I want to wake you guys up because our topic for today is very timely and you really have to listen, no? Para ma-absorb natin ang lahat ng sasabihin at mangyayari ngayon because we don't want to have information overload. No? So, as I said, sobrang timely nitong topic natin because I'm sure we're all looking forward to the day that we break free from this pandemic. Dahil although before it was like masaya na isipin na sige, nasa bahay lang tayo. Pero ngayon nakakatamad gusto mo na lumabas, gusto mo na makakita-kita ng mga tao. So, okay, before I go on to whatever pang chikahan, welcome to our talk. Welcome to Baka Naman. No more about COVID vaccines. 'Di ba? So, ayan na. Hindi ko napapatagalin pa because I'm sure mamaya ang Q&A po. We have a Q&A. We got your questions that you sent in via form. We will tackle them later if especially kung yung questions hindi pa na-discuss ng ating speaker. So sino nga ba ang speaker natin ngayon? 'Di ba? Sino ba 'to? Sino ba tong picture na nakikita natin? No? So try natin ito. I will tell you more about our speaker. So Dr. Albert Domingo obtained his Bachelor of Science in Molecular Biology and Biotechnology and Doctor of Medicine degrees from the University of the Philippines. He is a health systems specialist with a Master of Science degree in Health Systems and Public Policy from the University of Edinburgh in Scotland. Obtained as a Chevening Scholar of the United Kingdom. I hope I said it correctly. He is also familiar with the general principles of health law. He has over a decade of experience in global public health at country and international levels, having worked with USAID, the World Health Organization, and health officers at all levels. So Dr. Domingo uses a health systems strengthening lens in advising ministries of health, social health insurance agencies, national and local government authorities, development partners, healthcare providers, and patient groups. He has worked on health system functions in the context of maternal and child care, sexual and reproductive health, HIV/AIDS, tuberculosis, malaria, and pandemic response, particularly COVID-19. Sobrang dami, no? Na-establish po natin napaka-broad ng experience niya. So may we call on screen our speaker for today, Dr. Albert Domingo.
Good morning, magandang umaga sa inyo lahat. Good morning, Ma'am She Carol. Pwede ba katang tawaging Ma'am She Carol? Right, so thank you so much to the Taskas team for welcoming me to join you in this morning's, Baka Naman dialogue. I just love how you kept on saying break free. Parang naririnig ko na si Ariana Grande nagpo-play in the background na this is the moment we will break free from the pandemic. And how do we do that? We're going to find out exactly through vaccines and vaccination. So in a bit, I'm going to share my screen. So let me share a few slides. Huwag kayong mag-alala. Hindi ito mahabang, boring na presentation. I'd rather do it in a Q&A format. So direct transition na tayo. Mag-share na tayo ng slides para makita natin yung ating slides very soon. All right. So here we go. I'm going to share now my screen. Stand by. Ayan. Ang galing talaga ng ating engagement team, no? Para talagang very appropriate ang ating format. And yes, here we go. Okay, nakikita na ba yung slides? Yan na ang ating yan. Do not worry, it's not going to be a long winded lecture. So this is about vaccines and vaccination. Marami tayong mga tanong, marami tayong mga agam-agam. We have a lot of concerns about the vaccines, but before we dive into the particular vaccines, it is important for us to understand why exactly are we doing this? Bakit ba natin gusto magpaturok? Why do we want a needle stuck into our arm? What is this all about? So remember, you've been seeing in the news, ito sobrang fresh, I was cramming. Before we started at 10 a.m., sabi ni Ate Carol sa akin, ni Ma'am Shi Carol, Doc Albert, nasan ka na? 9:55 na, but wala ka pa sa call time? Because I was cramming and looking at the latest news. If you do a Google search about the Delta variant, about vaccines, you will find out that in the United States, no, from left to right, you're going to see na si Dr. Anthony Fauci, he's quite famous, no, kasi siya yung pinaka-lead nila, lead advisor ng White House, the US president on this pandemic response. And Dr. Fauci has been warning that the Delta variant is the greatest threat to US COVID efforts. Bakit napasok yung usapang Delta variant? Doc Albert, di ba ang usapan natin is about the vaccines? You have to understand, sino ba yung kalaban? Why are we putting this shield? Why are we using this defense of the vaccines? Ang latest, no, ang latest scoop, ang kalaban natin is yung Delta variant. What about in the UK? In the middle panel that you're seeing on the slides, on their slide right now, Prime Minister Boris Johnson extends England's long pandemic restrictions as the variant. Yan na naman yung variant, Delta variant. Stunts vaccine rollout. Still connected to the vaccine rollout. People in the UK thought that they would already be breaking free, kaya nga ni Ariana Grande, breaking free from this pandemic very soon. But wait, even in the UK, nag-extend yung lockdown. So it's not just in the Philippines, no, na nagla-lockdown na naman. And to the rightmost of the panels, no, the third one, India's second wave of the COVID pandemic is definitely not yet over. So wag natin pansinin na magfe-flex si Kuya dun sa kanyang panel. But anyway, the point is, it's not really looking good in India. The second wave, which is happening, is not yet over. And speaking of waves, if you look at the graph on your screen right now, yan yung mga waves na sinasabi. For the longest time, we keep on hearing this idea, we need to flatten the curve. Yan. Actually, ito yung strictly speaking tinatawag na epidemic curve. How do you read this graph on screen? At bakit ko pinapakitaan ng graph? This is to compare in numerical means, no? In a graphical sense, what you're seeing here in pictures and news. This is to compare, look at the line, di ba? Sino ba yung mga tiro-compare natin? Si United States, si United Kingdom, tsaka si India. Tsaka syempre, ang ating bansang mahal, the Philippines. All right, so you have the UK, which is your purple line here. Follow the purple line. You have the United States. I think this is ano ba to? Green, blue-green line, yes. And then you have India, which is your pink, and the Philippines, which is your orange line. I want you to be aware that it doesn't mean na mababa yung Philippine line is we're doing better. It's only because there is a lot of, as highlighted here, limited testing. So let's look at what the numbers are telling us. Yan yung mga waves, no? Yung mga literally yung mga waves. You have the crests of the waves. You can see that they're almost all countries, no? Actually, the two countries, ano ba to? United Kingdom and the United States had a very big wave around November 2020 up to February. What I want to highlight here is why are you seeing here, diba, naka-pointer ako ngayon, why is there a sudden dip in the wave of the United Kingdom and the United States around the start of 2021? Bakit biglang bumaba? In the same way, look at the start of the year from February. Ito na si Philippines. Ito yung ating wave na kasalukuyan nangyayari ngayon. The third wave that we are experiencing right now. More bothering is the fact that in India, by the way, all of the curves that you are seeing are adjusted according to population. So these are cases per million people. Patas-patas lang yan. Look at India. Tumataas yung kanya. Ito yung sinasabi nga na third wave. Hindi pa sila tapos. It looks like it's going down, but it's still not close to where it was before, na zero. And ito pa, si United Kingdom, kaya ang sabi ni Prime Minister Boris Johnson, we have to extend the lockdown to July 19 kasi tumataas, and they are blaming the Delta variant. But before we go into the bad news, let's look at the good news. Bakit nila napababa? Why were they able to bring down this wave around the start of 2021? And I'm now shifting to this next slide, and you can see the rate of vaccination, how many people in those countries mentioned, in the four countries, have been vaccinated. The percent of the population, rather, have been vaccinated with at least one dose of COVID-19 vaccine, whatever the brand is. Ang taas na ng United Kingdom, lampas 60%. Population of United Kingdom, around 60 million. United States, lampas 50%. Population of the United States, 300 million roughly. Impressive ang India, almost 20%. Bakit siya impressive? 20% lang. Well, that's 20% of 1 billion people, no? And then the Philippines, kaka-announce lang kahapon, nasa 10 million na, so baka hindi pa na-update to. But still, 10 million people, since nasa 100 million tayo, roughly mga 10%. This is the reason, these are the reasons rather, why you are seeing the news articles. Bakit sa US, hindi na nakamask? Notice, hindi na nakamask si Dr. Fauci, pero kinakabahan sila kasi nga may variant. Bakit sa UK, they want to extend kasi kahit mataas na yung kanilang vaccination rate, meron pa rin Delta variant tayo. And why in India, they are frantically rolling out vaccination? It's because they want to flatten this curve by increasing the number of people who are vaccinated. Why is this important? Ang tanong ko po, my question for all of us, hindi ba tayo napapagod sa nakikita nating graph ngayon, sa nakikita natin on screen? Yes. Why am I showing a very complicated chart here? Let me make it easier. Let me simplify. If you look at the yellow bar in the middle, it highlights a chain, no? A results chain. Susceptible, exposed, infected, recovered. A cycle, SEIR. In epidemiologic terms, this is what the scientists, this is what the medical practitioners look at. Kasi at any given time, we may be healthy, as you can see in this Filipino family staying at home, but we will always be susceptible. Pwede tayong tablan ng virus. If we go out and we are exposed because we have to report to work, we are required to go on site kahit mas maganda na stay at home tayo, then we are exposed to possibly to the virus that causes COVID-19, and we might have to be tested and we have to have precautions. And then if we are tested and found to be positive, we become infected, no? So from being susceptible, we become exposed, then we become infected. And if you are old or if you have comorbidities, you can actually end up in the ICU, as you can see in this picture. In most cases, people do recover because a lot of people actually just get mild to asymptomatic infection. However, there will be a few, and when I say a few, even a single life is still alive, who will actually end up dead. Ayaw nating mangyari yun. So this is the reason why the government has been doing a lot of steps, no? Whether it's the Philippine government, the UK government, the US government, paulit-ulit yan. PDIT. Yung term natin sa Pilipinas, PDIT. Prevent, detect, isolate, and treat. Yung prevent, wash your hands, wear a mask, maintain distance, yan. Detect and isolate, contact tracing, get your nose and your throat swabbed and tested. You get isolated if you're confirmed. Treat in the hospital. But we are talking about vaccination here. No, why are we talking about this, Doc Albert? Parang maling channel yata. No, this is the correct channel. I wanted to show you this because if we will not achieve the required number of vaccinated Filipinos, we will keep on doing this forever. Oh my God, meron palang forever. Yes, pwede magkaroon ng forever, pero nakakapagod po ang forever kapag paulit-ulit natin ginagawa ang PDITT. And we need to end the pandemic as soon as possible. How do we end the pandemic? Two ways. Either the epidemiologic endpoint, which means hindi na tayo nagkakalat ng virus, or a transition to normalcy, which means kahit mahawa tayo, hindi tayo kinakabahan kasi ang mangyayari sa atin ay just simple cough and colds or fever at hindi yung ICU, hindi yung critical care, hindi yung mapapasok ka sa ICU, gagastos ka ng 2 million pesos, hindi ka pa sure kung mabubuhay ka kasi baka paglabas mo, abo ka na lang, cremated. We don't want that to happen. If there is a transition to normalcy, if you are vaccinated, you are protected against severe disease. At the very least, hopefully, baka ma-break rin yung transmission. So how do we do those things? In comes the terms that you are hearing, herd immunity, population protection. I wanted to start off with this particular slide. When we started this talk, when you sent your questions to Ate Carol, to Ma'am Shi Carol and the engagement team, to your HR, to your managers, to the Taskas administration, you were all curious about protecting yourself. Ang selfish nyo. No, it's okay. Selfish tayong lahat. We all want to protect ourselves. But did you consider that vaccination is not only about protecting yourself, the individual, but also protecting the community? Your lolo, your lola who cannot be vaccinated, maybe because they are immunocompromised. Although lahat ng mga lolo't lola ini-encourage ma-vaccinate, no? Very, very few lang talaga yung di ma-vaccinate. Or yung kids, kung meron ko yung mga anak, mga kapatid, mga pamangkin na below 12 years old, hindi pa sila pwedeng ma-vaccinate. They cannot be vaccinated. So it is our responsibility as adults who can be vaccinated to protect them by enclosing them in a ring, no? So pag nakita natin yung mga tao na to and you convert that to a ring, let me explain now the concept of herd immunity. Naririnig lagi natin to, no? Ano ba yung herd immunity? It sounds like we're being herded like cattle. Well, ladies and gentlemen and everyone listening, that's exactly the reason why you call it herd immunity, because it came from a concept scientists observed in animals. A group of animals, even though not all of them are vaccinated, but if most of them are vaccinated, those who cannot be vaccinated are protected. Let's see why. For example, if there is someone with COVID-19 who enters a room full of people, the people are in gray and they're in orange, they're unvaccinated as you can see on your screen, it is very easy for that person with the virus to spread, no? Hawa-hawa na, damay-damay na to. Lahat tayo sa task us maging COVID-19 positive. But if one half of those who are inside the task us room, whatever, are vaccinated, protected na ba tayo? One half lang? Well, hindi pa siya ganun ka-protected kasi yung 50% na hindi vaccinated, tatablan pa rin, no? So yung mga naka-green, sila yung nauna. Siguro, I heard, medyo marami-rami rin na vaccinate. Pero yung mga ayaw magpa-vaccinate, tatamaan pa rin kayo ng COVID-19 kasi hindi kayo vaccinated eh. Now, what about if a lot of you who are listening right now will convince yourselves and also those who are around you that yes, we need to get vaccinated so that those like this yellow person here who cannot be vaccinated because he has a valid medical reason, probably is immunocompromised, is a cancer patient undergoing chemotherapy, is a person living with HIV whose CD4 count is below 400. There are a few exceptions na talagang hindi pa rin bakunahan. Or is someone who is pregnant in the first trimester of pregnancy. First trimester, no? Kasi pag second and third trimester, pwede ka na mabakunahan. Then that person is protected by those others who are vaccinated. Why? Because even though si ate ba to o kuya, hindi ko alam, basta kung ano man siya, na meron siyang virus, hindi niya makakalat yung virus kasi even though tinatry niyang spread, hindi makakalampas yung virus dun sa mga vaccinated people who are surrounding that infected person. That is the reason why we are having this webinar, this little talk. That is the reason why we are all trying to convince each other to get vaccinated. And when we do get vaccinated, we need to find out why or how does it work, no? So wag tayo mahilo. You are seeing on screen right now a brief explanation, a crammed explanation of the immune response. Look at this little circle with spike proteins around it, which my laser pointer is highlighting. This is a depiction, no, an illustration of SARS-CoV-2, which is the virus that causes COVID-19. There is a crown of spike proteins. Yung spike protein, yun yung kumakabit sa ating cells, which causes the cell to become infected at dadami yung virus. If you look at the panel to the right, this is a summary of the immune response. When the immune system recognizes that spike protein, it starts to produce, on the one hand, antibodies, which will prevent future copies of the virus from infecting the cells. Or, on the other hand, it will trigger cytotoxic T cells, or what we call killer T cells, to destroy the infected cells para hindi na tayo magkaroon ng hawaan inside our bodies. Kung nahihilo kayo sa dami ng manaririnig yung terms na antibodies, cells, receptors, proteins, simplihan na lang natin. Let's talk about Miss Universe because the reason why it's called a coronavirus, there is a crown. Meron siyang crown of spike proteins. It is that crown, no? Nakikita ba sa camera? Yes. Parang gano'n, nakikiano tayo, Miss Universe. It is that crown which all the vaccines are introducing. The crown is the one being introduced to your body. Whether the vaccine is an mRNA vaccine or is a vaccine that is on a vector or is a protein subunit vaccine, they all introduce the crown. All of them, their goal is to produce an antibody to the new pathogen, to make the body find out how to defend itself from that new virus, no? The vaccine shows the crown, and then the body, among other things, produces a new antibody to produce protection against that virus. And how does how does the vaccine, how do the vaccines do that? You can do it either using a whole virus or bacterium. You can do it using the parts, the crown itself of the virus, or you can do it using the instructions, the genetic material inside the virus. And this is a summary of the different kinds of vaccines that we have on hand. The vaccines that use the whole virus, the inactivated virus, would be your Sinovac, Sinopharm, yan silang dalawa. Yung live attenuated, walang gumagamit yan. In other words, lahat ng mga virus na ini-inject sa vaccine ay patay na virus. They are dead virus, they will not infect you, they will not replicate. You do not need to quarantine if you are vaccinated because it's a dead virus. And then yun naman naririnig natin na AstraZeneca, yung Janssen, yung Gamaleya, yun yung mga viral vector vaccines. They use a different kind of virus, but the virus, it's like the first runner-up of Miss Universe. Hindi siya yung talagang Miss Universe, pero suot-suot niya yung crown, no? Yung corona, the spike proteins. Tapos pinapakita niya sa katawan, yung corona para makilala ng katawan natin na, aha, you are the substitute Miss Universe, but you're still wearing the crown, so I need to get rid of you. That is the analogy. So, Pfizer and Moderna, they use the nucleic acid vaccine, they use the instructions. Novavax or Novavax, nalilito ako lagi sa Novavax. It uses the subunit approach, but it's still under research. So I will not be able to answer a lot of questions about it because I just checked. The latest information is hindi pa tapos yung studies, baka third quarter 2021 pa matapos. And speaking of studies, all of the vaccines, including the one that your company is interested in, they have to pass through all of these steps. Normally, these steps, if you look at the bottom and you add those years, 8 plus 10 plus 2 equals, on average, 20 years before you produce a vaccine. But Doc Albert, isn't that cheating? How did the COVID-19 vaccine get produced so suddenly, so fast, in less than 1 year, if you're telling us right now that all of these steps require 20 years? Simple, boys and girls, ladies and gentlemen, and everyone there. It's because of money. No, it's not bad, but it's the reality in life. When the governments of the UK, the US, Germany, and the other rich countries became scared of the pandemic early on in 2020, they realized the impact on the economy as we are feeling it right now. Their leaders decided we will spend millions of dollars, euros or whatever currency, millions of dollars on research. And that is the reason why, if you compare to the other diseases, si COVID-19, which is at the bottom, how do you read this graph? Kapag meron kayong nakikitang green bar, meron ng bakuna. Kapag wala pang green bar, wala pang bakuna. So si COVID-19, ang bilis, no? Less than 1 year, may bakuna na. Kasi ginastosan eh. There was a lot of money poured. There were no shortcuts. It still had to go through all of these phases, but there was a lot of money and a lot of interest. That's simply the way the world works, no? Political interest will lead to results. Malaria, wala pa rin bakuna. TB, wala pa rin bakuna. Dengue fever, wala pa rin bakuna. Zika fever, wala pa rin bakuna. Hindi kasi siya ganun ka-scary at hindi siya ganun kasikat compared to COVID-19 na lahat ng tao nagbuhos ng pera kasi gusto nating mag-break free from this pandemic. That is exactly what this is all about. When you read the numbers of the ratings on vaccine efficacy or vaccine effectiveness, I'd like to remind you that you do not interpret it as, let's say, 95% efficacy does not mean out of 100 people, there will be 5 who will get COVID. No. What it means is risk reduction. It means all 100 people who were vaccinated with COVID-19 vaccine have a 95% lower risk of getting COVID-19. But a word of advice, word of caution, do not compare the vaccines according to vaccine efficacy because they measure vaccine efficacy according to mild or asymptomatic infection. Ang tanong dito is, magkakasipon ka ba or magkakaroon ka ng PCR positive test? Hindi yun ang importante sa ngayon eh. Remember our discussion a few slides ago? We want to make sure that we return to normalcy, that we will not be afraid of the ICU. Guess what? All of the vaccines, regardless of the brand, they have very high efficacies against hospitalization. Repeat, yung mga nakikita yung number na kino-quote ng mga companies, 95, 70, 60, 50, they all pertain to cough and colds, to PCR positive. Pero yung hospitalization, lahat sila almost, if not 100% effective or efficacious against hospitalization. And how do you find out all of these things? There are a lot of experts in the Philippines alone. You have the vaccine expert panel, you have the Philippine Food and Drug Administration, you have the Health Technology Assessment Council, the National Immunization Technical Advisory Group, and even a committee that monitors side effects. Let's look at who the approved or what the approved vaccines are in the Philippines right now. In order of approval, not in order of efficacy or promotion, or only in order of approval: Pfizer, AstraZeneca, Sinovac, Gamaleya. Dito pa lang, sa slide na to, yung apat na yan yung meron na sa Pilipinas. Si Moderna, kakadating lang, I think yesterday or the other night, basta kakarating lang niya. Pero si Moderna yung nasa dulo sa right side, no? Pero si Johnson and Johnson or Janssen vaccine, tsaka si Covaxin, si Bharat, wala pa sila kahit meron silang approval in the Philippines. Nasaan si Novavax? Wala pa po siyang approval kasi under study pa po siya. Novavax is still in its phase 3 clinical trials ongoing in the United States and in Australia, also in the United Kingdom. So it's not yet available. I cannot comment. I cannot give you advice on whether it is safe in this population, what its efficacy is, because the data are still not available. I like to emphasize that. We will have a slide that I will show you. But in summary, these are the different mechanisms of action. Sinovac, Sinopharm, and Bharat are all inactivated or dead virus. Pfizer and Moderna are nucleic acid vaccines. AstraZeneca, Janssen, and Gamaleya are viral vector vaccines. And Clover and Novavax, which we are waiting for, are protein-based, or they just show the crown to the body. Yan yung mga examples of the different kinds of vaccines. And who has approval in the Philippines? Yung may color green na shading. All right. Ito yung summary table ng DOH, the different properties. In summary, what am I trying to say using this slide? Simple. Do not compare so much the vaccine efficacy when it comes to symptomatic or mild infection or asymptomatic infection, PCR confirmed. Compare it when it comes to severe COVID-19 or hospitalization. All of them have very high ratings against moderate or severe cases. And that's what counts at this point in time. Kasi napakamahal ma-confine sa ospital for COVID-19. Going rate 1.5 to 2 million pesos, hindi ka pa sure kung mabubuhay ka. Do not be afraid of side effects. Why am I showing this slide? One of the particular vaccines, AstraZeneca, was reported to have what you call vaccine-induced thrombotic thrombocytopenia. Do you want a tongue twister? Let's say that 3 times fast. Vaccine-induced thrombotic thrombocytopenia. Once na lang, VITT. But do not be afraid because the left panel of the screen shows there are already clinical practice guidelines rather by the American College of Cardiology. We also have an equivalent in the Philippines. Doctors know what to do in case you get it. But the question is, will you even get it? If you are 25 years old, let's look at your chance in a million. No? How many chances in a million do you have of dying with coronavirus? The answer is 23 chances in 1 million. What about getting VITT? 11 in a million. You are more likely to die because of COVID than to die because of VITT. So nanggaling yan? This is based on the number of people vaccinated in Europe with AstraZeneca vaccine and those who actually did present with the VITT symptoms. In fact, you are more likely to die of a road accident, maybe especially in the Philippines, I don't know. Because dying in a road accident is 38 in a million chances compared to 11 in a million chances of getting VITT. No? So it's really a rare side effect. Just because you see a side effect reported doesn't mean that you will get it. It only means that doctors are very alert. We found out that there's a side effect and we are ready in case this side effect happens to you. Just on summary, as of June 13, again, do not compare the brands. No? Just because you're seeing this chart does not mean that, oh, mas okay pala si Sinovac at pinaka-pangit si AstraZeneca. No, that's not how to read it. Bakit? This is a report of the number of non-serious events per 1,000 doses. But if you look at the number of doses administered, mas maraming Pilipino, 4.3 million already, ang nabigyan ng Sinovac compared to AstraZeneca, and then much less pala si Pfizer, and much less si Gamaleya. So hindi talaga comparable. But just to show you that even on a per 1,000 dose basis, ang konti AstraZeneca people, only 10 out of 1,000 given AstraZeneca will have a non-serious event. What's a non-serious event? Fever, fatigue, diarrhea. Hindi serious yan. What about the serious? Yung mga nag-anaphylactic shock, hindi makahinga, nag-seizure. Very, very small, 0.17 out of 1,000. Does that mean the vaccine is not safe? No. It means the vaccine is very safe because our system, this is Philippine data, FDA, our system is able to track adverse events. And what are examples of the adverse events? Yan na. Baka may nagsiscreenshot, baka may nagpipicture. Hindi ibig sabihin na nandiyan yung side effect ay mangyayari sa inyo. It only means that we are aware, medical professionals are aware that these are the possibilities. So that when you come to us and you tell us that you feel this, one of the questions we will ask is, were you vaccinated lately? Within 2 days or within 1 day, ganyan. Tapos tsaka namin ma-advise kung anong kailangan gawin. Because most of these side effects are actually mild and non-serious and can disappear with paracetamol and any other drug that is an antipyretic. Ibuprofen, paracetamol, yan, yung mga ating common. In fact, yan, the data from the Philippine FDA shows that 80% and up of those suspected adverse reactions recovered and resolved. In fact, the remaining 12% as to the date of reporting were recovering and resolving. Pwede mo nang i-add yan. So mga 93% gagaling talaga. Doc Albert, bakit meron 0.66 dyan na namatay? It means the system was able to track those who died, but those who died were not because of the vaccine. And who gets to say that they were not because of the vaccine, the deaths were not because of the vaccine? Because we have a committee of experts, neutral, independent experts, all Filipinos still, experts in their field, doctors, virologists, immunologists, who analyze each and every case. At sila nagsasabi, this is because nagkaroon ng heart attack not related to the vaccine. This is because matanda na yung nabakunahan, talagang time na niya, mamamatay na talaga siya. This is because this particular person died because of COVID-19 kasi 1 dose pa lang siya, hindi pa niya na-complete yung 2 doses. Yun yung mga nangyari na 0.66. They were not because of the vaccines currently in use. Just a few last slides before we finish and go to Q&A. Do not mix and match para sa mga nabakunahan at sa mga balak magpabakuna. Huwag muna mag-mix and match because as this particular screenshot shows, the studies are still ongoing on whether or not it is safe. We will only find out after 6 months. We also don't know how long immunity will last because wala pa tayong 1 year since the first person in this world was vaccinated. Inoobserbahan pa po ang longevity ng ating mga vaccines. Also, in case you are vaccinated and you want to compare antibody levels, please, that's useless. Do not go to the laboratory, get tested for your antibodies because the test for the antibody in the laboratory is not the test for the antibody that the vaccines produce. It's also not the test that can tell you about cell-mediated immunity. Remember, there are 2 mechanisms for immunity, antibody-mediated on the left, kung naaalala niyo yung slide kanina, and cell-mediated immunity by the killer T cells, di ba? I said kanina, killer T cells. Hindi na-measure ng mga antibody tests ang mga killer T cells. Ultimately, vaccines are part of a vaccination campaign. It's quite complicated from the moment you get the QR code, you register, and that you are vaccinated at the point of care by your nurse or by your doctor. And there are special conditions, which is why do not get vaccines outside the local governments or outside your company if your company is already authorized by the National Task Force because there are special conditions of storage. This is an actual photo of the 3 different kinds of refrigerators. If your eyes are strong enough, you will see that this big refrigerator here says negative 81 degrees centigrade. This particular ref in the middle, hindi na siya mabasa, pero it can go as low as negative 40. But when I took this picture myself, negative 22, ganong kalamig. And then the one on the right, the blue little cute freezer is around 2 to 5 degrees positive centigrade. To compare, your freezer at home, where you put your ice cream, is around 2 to 5. Kasing lamig siya nitong blue. At yung mga vaccines na pumapasok dyan, si AstraZeneca, si Sinovac, I think Novavax will also be part of that. Yung nasa gitna, para kay Gamaleya, no? Negative 20. Mas malamig siya. Hindi siya kasing lamig. Mas malamig pa siya sa freezer nyo. At lalo na yung Pfizer at Moderna, negative 81. Baka kasing lamig ng puso ng inyong X. Char. All right. Now, the vaccination procedure, it's very straightforward. You register, you are screened, you are vaccinated, there is monitoring. I will not go into the detail here because this is something best discussed already by your company when you're about to be vaccinated. Finally, make sure you complete 2 doses. Yan, hindi kami kambal. Ako rin yan. Dose 1 on the left in white, dose 2 in red. I got a vaccine with 2 doses. Actually, lahat ng vaccines, 2 doses. Wala pa tayong single-dose vaccine. Si Janssen yun. Hindi siya available. So, please make sure you get 2 doses because if you just get 1 dose, mukha kang haggard. Look at me kasi medyo pawis-pawis ako dito sa picture na to. Iba kasi yung site na pinuntahan. Iba yung kabila na sa loob ng mall. Ito, medyo haggard tayo na sa loob yan ng isang gym. And finally, last few words, the vaccines are just one layer of protection. We still need to do the other layers. Bakit? Kasi hanggat wala pa tayo sa herd immunity, hindi pa tayo makakasure na pwede tayo lumabas without a mask, without a face shield, without washing our hands, without physical distancing. All of those are taken together so that the virus will not reach us. But the vaccines do give a very big amount of protection. So thank you so much, and I'm now exiting my slides direct. Maybe we can go to Q&A, Ate Carol, Ma'am Shi Carol, and we can start discussing questions and answers. Back to you.
Ayan, thank you so much, Doc Albert. So actually, napaka-dami, no? Binulabog tayo ng mga comments sa ating chat box. So let me call on Dr. Albert. So sabi nga natin, may Q&A tayo, no? And I'll also want to give you some information. No, we released, People Champs released a survey on to find out ilan ba sa atin sa Task Us ang vaccinated, ang hindi, no? So let me give you the numbers. I think though that marami hindi pa talaga nagfi-fill out. So fill out nyo na po sa HCM. So it says that 111 are fully vaccinated. That's 1% of our population is fully vaccinated. So nakakuha na sila ng 2 dose. Ang partially vaccinated is 2% or 408. And then I am not, oh no, wait, hindi ko mabasa. Maliit kasi, ganito, mahirap talaga pag tumatanda. Medyo hindi na kaya, no? I do not, yung ayaw ma-plan na pa-vaccinate, 262. Guys, sana, I hope that you were able to watch, no, you were able to watch the talk of Doc Albert. So I hope that it has shed light on some of your questions, mga agam-agam, and ma-convince kayo na pa-vaccinate na. So let me call on Doc Albert for our Q&A. Yes, Doc, kasi hindi ko kayang sagutin.
Yes. Hello.
Okay. Ayan, Doc Albert. Thank you so much, no, for all that yung mga sinabi mo about us. Ang dami. Actually, ang sabi dito, ang aliw naman ni Doc. Tapos sabi, naintindihan daw nila, na-gets kasi nila yung corona. Yung Miss
Diba?
Universe. So example for us to understand adult learning. Thank you daw, no?
Yes.
The use of real life example. So a lot of them
Jason.
Got to understand better, no, what is happening with our vaccination and everything. But let me go down na to the questions, no.
Sure.
Siyempre yung unahin ko na muna though. Alam mo naman dito tayo kung ano yung pinaka-controversial, yun ang talaga. So you mentioned something about Novavax. Kasi
Yes.
Of course Novavax is the free vaccination that Task Us will provide. No? So a lot after you mentioned, no, kasi I remember when we talked, sabi mo nga medyo konti pa lang ang nasasabi about Novavax, no? It doesn't have a permit yet per FDA. However, ang kanilang per Unilab, ang target nila is July. So next month, they're targeting to get the FDA approval. Ganon.
Okay.
Yun ang sabi. No? So, ang tanong, Zo, kasi nagkaroon tuloy ng siguro medyo, bakit yun ang kukunin ng Task Us? Diba? Natakot tuloy sila. Although ako naman, I've been with Task Us for more than 5 years. I know that the people behind the company has always prioritized yung needs ko. So, wala pa man ng FDA permit ngayon. I know that there was a reason why they chose that. Diba? Why they
Right,
chose.
right, right.
So, ako, maybe, kasi of course, the brand also, Unilab, is the one producing it. Okay naman ang Unilab, di ba, Doc? Di ba?
Yeah,
Okay
well,
naman.
sige, I realized naka-hide pala yung Novavax slide ko. So maybe I'm going to share another slide right now. So
Sige.
sharing a slide. And just so we can kumbaga discuss this Novavax question in detail, I realize it's so share ko na ha yung slide ko.
Oh,
Sige,
yes,
ito na
yes.
siya.
Go.
All right, let's go. Saan na ba yan? Okay, sharing the slide now. Right. So this particular slide is on Novavax, or ang kanyang generic name is NVX-CoV2373. I really did what I could even before, kaya nga si Ate Carol, tinatry akong habulin kanina bago mag 10 o'clock kasi kinakalkal ko talaga yung internet. Wala akong makita na data ng phase 3 ng Novavax as of this point. In fact, the Australian government advised its own citizens. The Australian government is going to get Novavax also, by the way. So you're not alone. There are a lot of governments getting this. Pero ang kanilang advisory is the phase 3 trials are still ongoing in the UK. Remember, meron ako slide kanina yung mga different steps. Lahat ng mga ibang vaccines tapos na or malapit na matapos yung phase 3 trial. Si Novavax, ongoing pa. Which is why I cannot answer. I cannot give any information on the age, on the profile of the vaccine, because all of those infos come from data from phase 3 trials, which are still ongoing. What we know from Novavax is in September 2020, the authors, Keach et al., Keach is the last name of the first author, Keach et al. In 2020 published a phase 1 or 2 trial which only had 83 trial participants. Okay, what am I saying? Hindi ko sinasabi ang pangit naman ng task kasi pinili ni Novavax, hindi pa pala tapos. No, hindi yan ang sinasabi ko. Ang sinasabi ko is there is a strategic decision by your company to choose one of the newer modes. The protein subunit technology is one of the last to finish, not because it's not good, but because a lot of the research went into the RNA vaccines, went into the vector vaccines. But there is a lot of excitement, no? Maraming na-excite na based on the phase 1 and 2 trials, maganda yung immune response and maganda yung safety profile. But because we are talking of a new vaccine, we have to wait for the phase 3 trials to even have interim results. And the projection is that will happen, sabi rin sa mga nakitang advisory, in Q3. Ano ba ang Q3? Anong month ang simula ng Q3?
July.
Is it yun. So eksakto. So nag-a-align pala lahat. So yung promise ng Unilab seems to align with the expectation na July siya. But remember, pagka kayo nagsiset ng deadline, pag sinabi niyo sa inyong manager na July, it could actually mean July 31. It's still July, di ba?
Yes,
So
still July,
do not expect na July 1 ay darating siya. It could be July 31. July pa rin yon. So manage expectations. You have selected one of the very good candidates for vaccines, but you just have to be patient because the data are not yet available, at least until the full month of July. And when that happens, it usually takes just 1 or 2 weeks before for the FDA to approve what you call an emergency use authorization. So mangyayari rin yan. So hindi ko lang kayang sagutin yung questions on safety profile, safe ba to sa breastfeeding, safe ba to sa ganyan, kasi wala pa tayong data on that. And I will stop sharing now and we can go back to our Q&A.
Actually, tinanong mo nga, may nagtanong nga dito, how long will it take for them to get the approval? So roughly mga 2 weeks, no? So actually, thank you so much, Albert. I think medyo na-appease na yung ating team bahay. Kasi inisip nila, ang dami na biglang, bakit yan? No? So, pero actually, naisip ko rin, this vaccine that Tascas is gonna give us is, at least if you're not yet vaccinated dun sa LGU, pwede mong kunin. Pero A4 naman ang sa Tascas eh. Diba?
Because A4 kayo.
A4 because of BPO. We're a BPO.
Oh, yes.
It's already free sa LGU. So actually ako, na-vaccinate na nga ako eh. Diba? Although hindi
I'll give you a tip.
Ah,
I'll give you a tip, Ate Carol, no? So kung
mm,
bibili ang company ng Task Us ng Novavax, I
mm,
suggest na yung mga core employees kayo, na employees ng Task Us, and you are A4 eligible, magpabakuna na po sa inyong mga
mm,
LG, A4 eligible na kayo. And then, you convince your managers, I'm sure they will probably think the same, na yung incoming na Novavax doses can be given to your families. Kasi maybe your family might have, baka hindi A4, baka meron kayong kapatid na physically fit na adult, so wala siyang sakit, hindi siya A4, baka estudyante siya pero above 18 years old. Perfect candidate for Novavax. And by that time, pag dumating na, hindi yan dumadating ka agad-agad eh. Ma-approve yan
mm,
siguro July. Baka yung flight yan, baka mag-landing, mag-welcome ceremony sila, darating yan mga August. So, by that time, kayong mga A4, bakunado na kayo with the other brands which are
mm.
all okay. And then, your loved ones can get, with the approval of your company, the Novavax vaccine. So hindi siya masasayang, hindi siya masasayang.
Yes. Actually, Doc, kasama talaga ang mga dependents namin sa libre na
Perfect.
bibigay ng Task Us. So, di ba?
Perfect.
So, at least, tama yung suggestion nyo. Actually, that's actually what I did. No, when Task Us said who's going to register for the vaccination ng Task Us, ang nilagay ko doon yung mga anak ko. Kasi
Yes.
wala pa for them, hindi pa sila hindi pa sila
Yes.
kapila, right? So at least
Right, right.
by the time that the vaccine, the Novavax will be available, malamang pwede na sila. Right? So
Correct, correct.
hope, no? So doon sa mga nag-ano na Novavax, after talaga nakita ko maraming mga nagtanong kinwestiyon ang move, no? But thank you so much for settling our fears, no? So ngayon itanong na natin yung iba, yung for general, no? Any
Game.
type of
Game.
vaccine. Okay, so if hindi namin ma-tackle yung question nyo, isulat nyo lang dito po. So, misconception, let us try muna, may mga nakuha kaming misconceptions eh. Is it true that if you get vaccinated, you need to be quarantined for 14 days? Kasi some say that after you got vaccinated and your body is weak, there is a chance that you will be infected.
All right. On the contrary, your body becomes stronger if you are vaccinated. That is the main purpose of the vaccine. What you feel, baka kasi yung nararamdaman na in the first 48 hours, in the first 2 days, yung nanghihina or yung naglalagnat or yung iba nagugutom, yung iba nadudumi, diarrhea, that is a
Oo.
natural reaction because your immune system is reacting. It's recognizing the vaccine. But you do not need to quarantine for 14 days just because you were vaccinated. In fact, I myself, when I was vaccinated, less than 48 hours, nagwo-workout na uli ako. Hindi matigas ang ulo, pero kasi I was feeling fine. There is no contraindication to exercise if you are vaccinated. I just want to touch on a few commonly asked questions pagkakataon na
Sige.
natin, no,
Oo,
Ate Carol.
sige.
Ito,
Ikaw na.
alam na ni Ate Carol to. Pwede ba akong uminom, 'di ba? Alcohol. Can I drink beer, wine, whatever is if your poison of choice? Well, in public health, we would advise wag na kayong uminom, please. But if you really must drink, please avoid drinking 24 hours up to 48 hours, 24 hours before up to 48 hours after your vaccination. For the simple reason that your doctors need to monitor your body for any possible side effects. Ayaw nating magkakaroon kayo ng hangover on the day of the vaccination. Tapos akala ng mga doktor, teka, nabakunahan na ba yan? Bakit parang ano na siya? Parang medyo groggy na siya. Hindi pa siya nababakunahan. Yung pala kasi nag-binge drinking the night before. Wag. So wag muna tayong uminom
Nag-celebrate.
24 hours before. Nag-celebrate. Yan. Ano na, after 48 hours. What about smoking? As we always say in public health, wag na pong manigarilyo, wag na pong mag-start, or kung kayo ay naninigarilyo, mag-stop na po. You know what? The COVID-19 virus aims for the lungs. The more you smoke, the weaker your lungs become, the more chances for COVID-19 to win. So stop smoking. But if you really must smoke, which I strongly disagree with, wag na pong manigarilyo, start quitting na, di ba? Then, same thing, avoid 24 hours before up to 48 hours after your vaccination. Yan. Back to you, Carol.
Okay, thank you, no? Thank you, Doc. So, may nagtanong tuloy follow-up question dun sa vaccination, dun sa quarantine. So, wala na ba need, Doc, na mag-quarantine? I think, pag ma-vaccinate ka daw, di ba, Doc, parang kailangan mag-isolate ka. Hindi naman ibig sabihin na vaccinate ka na lagi ka nang lumalabas. Tama?
Yeah, okay. Okay. So yung tanong kasi kanina about quarantine means dahil sa vaccination.
Oo,
Yung
yes.
tanong ngayon na linawin natin yun. Yung tinatanong ngayon ni Ma'am She Carol, talagang iba-brand na kita na Ma'am She Carol.
Oo nga
Yung
eh.
tanong ni Ma'am yung tanong ni Ma'am She Carol na pwede na ba akong lumabas yung stay at home? O wala na ba yung stay at home restriction sa akin? No, you still have to practice the same. You might wonder, bakit pa ako magpapabakuna kung ganoon lang rin pala hindi magbabago? Because we can only start relaxing when we have achieved herd immunity. Remember, the vaccination is not only for yourself but for the population. Kasi kapag ikaw, kahit gaano kataas ng efficacy, no? Kahit sabihin mo na 95% efficacy yung vaccine mo, meron ka pa ring 5% chance na makakuha ng COVID. At kung ikaw lang ang bakunado, lumabas ka dyan sa labas ng bahay, tapos yung mga nakapaligid sa'yo, mga zombie, na hindi sila mga zombie, hindi sila bakunado, pwede ka pa nilang hawaan and you will probably get the disease because of the 5%. Walang sisihan pag nahawa ka. So, while the private sector is vaccinating at tumataas na yung number of doses, dapat mag-cheerleader tayo, di ba? Cheering na
Yes.
please get vaccinated. Tapos pag nakahit na tayo ng 70%, I guarantee you, government will start loosening the restrictions. Basta mataas na yung vaccination rate. Kaya nga, parang sa UK, parang sa US, yung pinakita ko sa inyo. Okay? Back to
Yes.
you, Ma'am Shi
Thank
Carol.
you. Thank you so much, Doc Albert. O ito, meron pa tayong isa pa. Is it true that once you're vaccinated, you're not allowed to be stressed?
Ay, pang
Bawal na
HR yan,
stress.
no?
Wow.
Nakita yung HR. Kung yan lang ang magiging excuse para wag kayong stress ng mga boss nyo, sasabihin ko yes. Hindi, I have to answer factually. Hindi siya medical contraindication ng stress para sa vaccinated. Pero definitely, mental health is part of a very good working culture. So please, whether you're vaccinated or not, it will still help your immune system kung hindi ka stressed. Kasi documented yun eh. Kung stress ka lagi, you have what you call the stress hormone cortisol. Umiikot yan, di ba? Laging deadline, deadline, deadline. Tapos parang puyat ka na, nanginginig-nginig ka na. Kahit hindi ka vaccinated, magkakaproblema ka kapag lagi kang stressed. So, always try to avoid stress, whether you're vaccinated or not. Back to
Or
you.
kung stressed ka, you find ways on how to manage that. Yung para hindi ka
Yes.
masyadong di ba? Kaya actually
bigyan ko kayo ng tip. Yung mga stress relief ways, yung mga you don't want to meet with friends often, no? But if you want, I'll give you a tip. Pumapayag naman ng IATF to have exercise outdoor. Pwede kayong
na.
mag-jogging. Pwede kayong mag-jogging together with friends. Naka-mask pa rin or maybe walang mask pero malayo kayo. I'll give you a tip. Kung fully vaccinated ka, kahit magtanggal ka ng mask only while jogging and while maintaining distance, hindi ka masyadong kakabahan na mahawa kasi vaccinated ka.
Ayun naman.
Diba?
So yan, alam mo madami talaga sa timbahay na sa task us kasi we promote healthy living. So marami talaga diyan gusto na talagang mag-exercise and all and they have been doing that at home. Pero at least it gives them the assurance na pwede palang medyo lumabas na para pag nag-exercise, di ba? So ito pa, next, bilisan na natin kasi ang dami palang questions pa. After we get vaccinated from one brand, can we get another vaccine done to increase our protection? Naninigurado, Doc. Naninigurado, Albert.
Right. If I were you, wag na muna kasi wala pa tayong complete data sa safety profile nung tinatawag na mix and match. Pag sinabing mix and match, either partially vaccinated or fully vaccinated with brand A, tapos you decide to add another brand B. Sa mga ibang sakit, sa flu, sa mga ibang diseases, okay lang yun kasi meron na tayong idea sa safety profile. But while we are waiting for information, the information will come out pretty soon. Actually, nagkaroon na ng interim results. Pero yung interim results, ang dami daw side effects. So nag-aantay pa kami mga doktor for better information that tells us pwede na tayong magpa-booster or pwede na tayong mag-antay for another brand later on. But for now, wag muna.
Ayun. Madami talaga nagtanong even dun sa comments natin ngayon, no? So thank you. Naano na ako. So at least hindi na pag na-vaccinate na ako, okay na tayo. Okay.
Yes.
Now, ito po. What is the minimum age to be vaccinated against COVID? Kasi meron dyan mga parents, no? Meron tayong mga teammates na parents and they want to know, I have a toddler, I have ganito, iba-ibang ages. So, pwede na ba silang ma-vaccinate?
All right. So currently, ang pinaka lowest or youngest age na allowed ng Food and Drug Administration of the Philippines, ng FDA, is 12 years old, and only with the Pfizer vaccine. 12 years old ang pinakabata. Now, you might be wondering, bakit pag pumila kami sa vaccination site ngayon kahit may FDA permission, ayaw pa rin bakunahan yung aking 12-year-old or 13-year-old? Because there is a prioritization. Children are not as susceptible. They are still susceptible, but they are not as susceptible compared to adults. Mas tayong mga adults yung tinatamaan ng COVID-19 eh. So, in the face of limited supply, kasi konti pa nga lang yung supply, ang priority ng government is to vaccinate adults muna. Kaya hindi pa pinapayagan ng below 18. But when the time comes that there's a lot of vaccines coming in, maybe, hopefully, baka towards the end of the year or start of next year, then definitely, bababaan na nila yung ages na pinibigyan ng vaccination.
Ayun, sige, good. So, hopefully nga, by the time si Novavax, kasi di ba July and what, pwede na tayo dun sa age ng mga bata. Di ba?
Let's see, hindi pa natin masabi. Fingers crossed.
Oo, di ba? So ito, marami pa talaga, pero ito siguro, is it okay for me? I am breastfeeding. Is it safe for breastfeeding? Marami tayong actually questions, no? So I remember when we talked, Doc Albert, meron yan yung mga gustong magbuntis.
Yes.
Mga buntis at saka mga nanganak na. So, take it away, Doc Albert. Ano nga ba ang dito?
Thank you, Angelica Atienza, for asking about the breastfeeding. Simulan muna natin sa mga nagbabalak magbuntis. If you are planning to be pregnant, I would advise na magpabakuna muna before you actually decide to consummate, diba, your deal, your agreement with your husband or your partner to become pregnant. No? So in other words, defer muna on any fertilization. Wag muna kayong use protection muna, use contraception until 2 weeks after the second dose. So, repeat, magpabakuna muna ng COVID-19, complete your 2 doses, then you count 2 weeks after the second dose, and then go ahead and conceive. You're welcome already to have your baby. Now, if you are already pregnant, if you are in your first trimester, first 3 months of pregnancy, wag muna magpabakuna. Yan ang hindi namin pinapayagan. If you are in your first trimester, first 3 months. But if you are in the second trimester onwards, so the 4th to the 9th month of pregnancy, it is safe for you to be vaccinated. Your obstetrician might have some hesitancy kasi wala pang data for those who are pregnant. Pero ang World Health Organization has given a recommendation na the safety profile insofar as the current information that we have are concerned is okay for those who are pregnant in the second to the 3rd trimester. Now, para sa mga nanganak na at nagbe-breastfeed, in fact, it is encouraged for you to be vaccinated kasi yung inyong vaccine will confer antibodies, magkakaroon kayo ng antibodies that can be passed on to your babies safely through your breast milk. Para bang 2-in-1, nabakunahan ka, at the same time, ikaw ang nagbibigay ng protection sa iyong baby habang siya ay nagbe-breastfeed. Back to you, Carol.
I think talagang yung mga mommies na nagbe-breastfeed ngayon, talagang mag-uunahan pa sila doon sa vaccination. Kasi pwede pala yung...
Mga momshi.
Sure, mga momshi talaga. Mga momshi talaga. No? So, ano na siguro mga 2 questions na lang. Okay lang ba?
Sure.
Albert, kasi medyo nag-extend tayo. Pero ang dami talagang questions, no? So, siguro let's go into... there are a lot of teammates that ask kasi meron silang mga health issues. No?
Yes.
So, kunyari, diabetes, PLHIV, SLE, ganyan, high blood. Meron silang mga medicines na ginagamit. Pwede mo bang i-summarize po lahat siguro? Kaya ba yung ma-summarize? Ayan, tapos ito pa, meron ano daw yung sabi na G6PD. Ganyan, may G6PD.
May G6PD. Nakalimutan ko na yung pangalan ng enzyme.
Channel eh. Hindi siya.
Well, okay, ganito yan. Siguro to summarize everything, the question is, kung meron akong sakit na ganito, pwede ba ako mabakunahan? Alright?
Yes.
Alright. Isa lang ang absolute contraindication. Meaning talagang hindi ka pwedeng mabakunahan. And this is your allergy to the vaccine. Kung ikaw ay allergic dun sa mismong bakuna, hindi ibig sabihin basta may allergy. Kasi baka meron kang allergy to food, baka meron kang allergy. Okay lang yun, pwede ka mabakunahan. So, kung allergic ka sa vaccine, doon ka lang bawal mabakunahan. Saka yung buntis, yung kanina, yung sinabi ko first
Mm.
trimester.
Yes.
Pero all other conditions pwede. Ang kailangan lang ng medical clearance if you are in an immunocompromised state. Ano yung mga immunocompromised state? Kung
Mm.
meron kang cancer and you are undergoing chemotherapy or radiotherapy or the other treatments for cancer, then you have to get medical clearance from your doctor. If you are taking steroids for any particular condition, like for example, lupus, no? Ang lupus nagiging
Mm.
ano yan, para bang cause for someone to take steroids. So kailangan get clearance muna from your doctor. Now, what about HIV/AIDS? If you are a PLHIV, it's best to get clearance from your attending sa mga treatment hub. Magbibigay sila ng clearance niyan, no? Tapos ang absolute contraindication lang na alam naman ng mga treatment hub kung ang CD4 mo is below 400. All others pinapayagan yan. So yun yung mga examples ng mga kailangan ng clearance. Pero if you have diabetes, you have hypertension, you have asthma, you have obesity, no? So height and
Oh,
weight ka,
yes.
basta magpa-certify kayo, certified obese. Meron talaga medical certificate. Kailangan po 'yon based on BMI. Go lang, pabakuna po kayo.
So dapat magpakita sila ng medical clearance o medical certificate, no? If
Yung
yung
pag
mga hindi,
immunocompromised.
pag immunocompromised, they have to get clearance from their doctor. But all
Yes.
other conditions, when they go get vaccinated, kunyari dun sa LGU nila, they only need to, ano ba yon, yung sabihin that they are.
Pwede. Hindi naman sabihin lang, kailangan rin magdala ng proof. Ano yung mga pwedeng proof para dun
Ah,
sa mga sinasabing comorbids?
oo.
Pwedeng reseta, prescription for medicine less than 1 year old. Wag naman yung sobrang luma na reseta. Tapos pwede rin mga laboratory results. Baka lalo na yung mga diabetic, meron kayong lab results na elevated sugar. Also within the last maybe 6 to 12 months, pwede tatanggapin rin yon. Kung meron kayong mga annual physical exam, no? May resulta kayo ng APE
Oo,
na
yes.
nakalagay yung sakit nyo, pwede na rin yon. So hindi naman kailangan ng medical certificate. Pero kung wala talaga kayong ibang documentation, kailangan nyo kumuha ng medical certificate. By the way, medical certificate is different from medical clearance, ha? Yung medical clearance, ibig
Oh.
sabihin, in-evaluate kayo, lalo ng immunocompromised. Yung medical certificate, sinasabi lang ng doktor na kilala ko tong pasyente, alam ko meron siyang ganitong sakit.
Okay. So, again, medical clearance if you are immunocompromised. Pero for
Yes.
all other comorbidities like asthma, diabetes, hypertension, ganyan, yun naman, pwede na yung medical certificate.
Yes, correct.
Yun. Okay. Ito na, last two na lang. Sorry, no? Hirit po, Doc
Go
Albert.
lang. Go lang.
If you are a COVID, meron dito, if you are a COVID survivor, should
Yes.
you take, ito nga, meron pa, those who previously tested positive, is there a number of months needed or resting period prior to the vaccination?
Perfect question, no? I was just asked that question over over Facebook kanina or Messenger ba yun? Basta may nagtanong, if you just came from okay, number one, kung meron kang active infection, kung kasalukuyan kang naka-quarantine, naka-isolate, wag muna. Wait for your isolation to finish. Sasabihin ng doctor mo when that is done, usually around 14 days after you were diagnosed. But if you just came from isolation kahit on the very last day or the day after the very last day, pwede ka nang mabakunahan. Allowed na yon. Hindi kailangan mag-antay, walang interval. As soon as you recover from COVID-19, you can be vaccinated. And by the way, there are studies that show that it will benefit you a lot. Mas mataas yung immune response na nagkaroon sa COVID tas nabakunahan. Hindi ko sinasabing kumuha kayo ng COVID. Sinasabi ko, kung nagkataon nagka-COVID kayo, meron kayong, para bang kanga ni Miss Catriona, meron kayong silver lining. Mas maganda yung immune response ninyo.
Hindi nawawala mga references na Miss Universe dito.
Yes.
Pero alam mo kasing mga Pinoy talaga, mahilig talaga, may pageant, talaga yan, addiction. Ito, meron pang I remember may nag-comment dito, Doc Albert.
Yes.
Sabi niya, how can we be sure that our elderly parents' conditions won't worsen after getting vaccinated, although they have no pre-existing illnesses? Parang I think a lot of questions actually, a lot of people say, is it safe? Is it
Right.
they are scared. They are scared. No, yung basic ang dami. They are scared to get vaccinated. Meron silang mga parang iba-iba mga fears.
This is the
Sige.
assurance that the vaccines are safe. There were thousands, tens of thousands of people internationally from different races and different age groups who underwent clinical trials. Sila yung mga naging test subjects.
Mm.
Kung naghahanap kayo ng nasubukan o nasampulan, sa Tagalog, meron na bang nasampulan ng virus na yan? Meron po. Meron bang matanda na nasubukan, tinurukan? Meron po. Paano nyo nasabi na safe yan para sa lolo't lola ko? Kasi meron pong grandma and grandpa, kasi English in the United States. Or merong ama and ano ba ang sa Chinese? Hindi ko alam. Basta there are many other, alam mo yan. pero may
Hangtong
mga iba
yata.
pang populations na nabakunahan because of the clinical trials. And that is the reason why hindi ako makasagot when it comes to Novavax. Kasi the clinical trials are ongoing. Kasalukuyang sinasampulan para sa inyo. Sinasampulan para sa atin. Pero under controlled conditions, no? So yan yung assurance of safety. Hindi basta-basta sinasabing safe until nasubukan na yan sa ibang tao.
Yes, alam mo biglang napaisip tuloy ako, Doc Albert, no. Yung na-realize ko, thankful ako dun sa mga taong pumayag na maging part of the clinical trials, because 'di ba this pandemic talagang wala ka namang alam, 'di ba? COVID, hindi mo naman alam, pero there were people that took the risk.
Yeah,
diba?
sugal yun kasi hindi mo alam kung tatalab sa'yo, hindi mo alam kung ikaw ay magkakaroon ng side effects pag clinical trial. Pero ngayong approved na yung bakuna, medyo sure na tayo na walang mangyayaring delikado sa'yo. Or kung meron man, mild lang. Ubo, sipon, lagnat ng konti. So yun lang yung mga mild na side effects na pwedeng gamutin ng paracetamol.
Yes, oo. So yun ba, yun na, I guess we can end there. Although ang dami pa talagang questions, Doc Albert. Siguro, okay lang ba na pwede ba silang magtanong sa inyo, or pag merong mga medical meron ka bang public na page or what na minsan naglalabas?
I do have. So I do have. I am on Facebook, Twitter, Instagram, pati TikTok, pero hindi ako sumasayaw sa TikTok. Sabihin na natin. Defensive, no? Malapit na. Konti na lang. Baka pagka marami nagtanong, baka sumayaw na ako na ito ang side effects. Joke lang. So you can follow me on Twitter at Albert Domingo. It's at Albert Domingo. On Instagram, it's the same at Albert Domingo. On TikTok, it's Dr. May DR Albert Domingo. Facebook, although baka full na, pero you can follow na lang, I guess. May profile on Facebook, yan. Pare-pareho yan. Sa TikTok lang nag-iba, may DR Albert Domingo. Tapos sa Facebook, just search for Albert Domingo. Makikita niyo yung profile picture ko na may hawak na parang cloth mask. And I'll do my best. Please do not message me in private kasi baka biglang mag-message sa marami. But if your question is something that I can answer for everyone else, baka mag-post ako ng para bang note or advisory na makakatulong sa maraming tao.
Oo, and guys, remember, si Doc Albert, lang siya, makakapagsabi siya tungkol sa vaccination in general, 'di ba? COVID vaccines, ganyan. But if your questions are about our task as kung paano natin gagawin.
Ay, oo.
Kung on-site ba ito, ganyan, hindi siya makakasagot kasi
hindi ko pwedeng i-approve ang sick leave. Hindi ko pwedeng i-approve ang sick leave ninyo.
So actually, if you have questions about yung free vaccines po natin sa Task Us, may lalabas sa baba. Feel free to reach the People Champs via glow stick and choose the following options in the drop-down menu. That's human resources, tapos benefits general, tapos benefits general inquiry. Ayan, dapat may lalabas na ticker Ayan na. So, doon po sa glow stick, okay? Kasi medyo nag-over na tayo, Doc Albert, but we really appreciate your time. Meron baka may last message ka para sa team?
Right. Last message. I'm very happy. No problem overtime. No problem because I'm almost always happiest when I find out na there is a chance. I've been given a chance to reach out. So thanks Karen Vergara and those others sa saying no. Kasi the more of us who are vaccinated, the sooner that, as Ariana Grande says, we can break free. Malapit na akong kumanta, pinipigilan ko lang sarili ko. You want to break free, di ba? Because we can't resist it no more. Sabi nga ni Ariana Grande. Ayaw na natin tong pandemic na to. Please, magpabakuna na tayo para pwede nang tanggalin yung mask, pwede nang tigilan yung mga ginagawa natin. That time will come. But until it comes, encourage all your family, your friends, your task as teammates to get vaccinated. And if you have questions, it's not only me. There are a lot of experts. Follow the WHO pages, the DOH pages. Yan yung mga sources of information para hindi tayo basta-basta maluloko ng fake news.
Yeah, Nox, may pa ganun pang ano, no? So, thank you so much, Doc Albert. We really, ang dami, ayan, nagme-message lang, thank you. Thank you sa very informative na talk, no? Thank you so much, Doc Albert, for enriching our minds and clarifying whatever misconceptions we have about the COVID vaccines. Ayan
Welcome.
tuloy-tuloy yung ano, oh. So, again, guys, if you have further questions about our Task Us Free vaccines, feel free to reach the People Champs via Glow Stick and choose the following options on the drop-down menu. That's Human Resources, then Benefits General, and then Benefits General Inquiry. So thank you so much, guys. This is Carol Zuniga together with EJ, Margot, Carl, and Cliff from the Cheer Squad. And in cooperation with our People Champs, we bid you adieu. And since you now know more about COVID vaccines and how it can help end the pandemic, baka naman.